So today what we're going to do is we're going to just examine a very simplified patient journey. Hopefully this works. Here, I'm going to jump here right away. So we know that obviously when a patient has a pain that's a need, they're going to research for a solution, which is they're going to research for a dentist. Or if they have a want, that's also a need. If they need, for example, cosmetic dentistry, they're going to research for a practice. The touch point here would be the World Wide Web or a website. That's the touch point that we're going to talk about how to optimize. The next stage of the journey would be a conversion. The conversion can be two different things generally. One can be when a patient actually clicks on a website and converts from a visitor into an actual prospective patient. So they click on the website, they make an appointment. We can optimize that touch point. Or it can be a conversion if they make a phone call. The touch point there would be the team member who picks up the phone. We can also optimize that touch point. The visit stage would be when a patient actually walks into your office, possibly the first time, and we say judging or appraising, but they actually going to be judging your practice at that point. And they also going to discover the possibilities that your practice can give them. So they're going to discover treatment options. Is this the right practice for me? Is this the doctor I'm going to trust to do maybe an expensive and long procedure? The treatment phase is when the patient actually accepts or declines the treatment, or sometimes the patient will not make a decision at that day, and they're gonna go and further research, talk to their significant others, and hopefully make a decision. Again, they're gonna either decline or accept the treatment. We can optimize that touch point as well, pretty well. The post-treatment, if a patient accepted treatment and they leave the office, it's again something that usually we don't talk about enough. It's very, very important. It's an emotional phase because the patient might be feeling pain or even scared because they don't know what to do after the treatment if they have different symptoms. And they also may be very happy about their treatment, and they're going to share the good results with friends and family, which results in referrals. So we can optimize that touch point as well. So let's run through this. Very interesting statistics. We have 60 to 80% of people searches online for a dentist, depending on whose research you're looking at. So there are so many different confusing numbers out there, but regardless what the actual number is, it's a big crowd. Obviously, these people are gonna gather information based on what they find. If you think about it, even if you're searching for a solution for anything else, it is a very confusing platform. You know, when you use the internet, there's so much digital litter online. To find a solution for something is actually not easy. You're gonna look into social proof. You're gonna also probably look into different reviews, for example, what people say about this doctor, but you're definitely gonna look at the website. So the need phase also has this interesting set of criteria of every person who makes a decision. Some people will make a decision just based on the ranking. So 20% of the people who are searching online will make a decision only based on ranking. So they pretty much just gonna click on the first result. Some of the people are gonna click on the organic results. So the organic results are the ones that are not paid results. Those are the ones that you have to work for long term, so called search engine optimization. And about 2/3 of the people are gonna click on the paid results. The paid results can be achieved by pay-per-click, which is generally Google Ads. So more than 10% will select the website and select, obviously, the practice that's the best looking website. And these numbers are actually higher when it comes to 50 and plus, or 55 and plus, even higher. Which, if you think about, is more like the dental implants and cosmetic dentistry, and they also have the purchasing power. So it's very important that 10% is a huge number. And again, very, very strong purchasing power. Yeah, so my team said don't use this slide because we're a bunch of geeks and there is so much fun stuff on this. And so probably I should skip, but couple of things easy to see that when you hear that anyone can do PPC, which is Google Ads, and you set up Google Ads, it doesn't work, you don't get the ROI that you would like. It is because it's actually a beautiful science to it. So there's so many sensitive little details there that can impact your KPIs, that if somebody is actually not specifically have an experience in dental PPC, then please don't even consider doing Google Ads with them, because there's lots of money going into that every single month, and then you're going to lose lots of money just because something is not set up correctly. Sometimes we see clients coming to us that they didn't track their results, or they don't record the phone calls, therefore they don't know why a conversion didn't happen, or they think that my phone is ringing but patients are not coming, so maybe Google Ads don't work. It is because there's so many things to look at, from misspelled words to like itty-bitty details that you have to consider and tweak continuously, that can significantly change your results when you do Google Ads. The other thing that we see is when a website is not optimized for Google Ads. So for example, there's certain things that will actually make conversion happen. If a person goes to a website and it's easy to click on making an appointment, it's easy to see what they are looking for, they're gonna stay on that page. That's actually called stickiness. So for example, if you have videos, then that person's gonna start watching the videos because they're interested. Maybe they're searching for dental implants. They are staying on this page longer. So what it tells for Google that, oh, this result was actually a good answer to the inquiry. These people are staying on the page, so next time I'm gonna bring that up again if somebody's searching for dental implants. So stickiness is actually helping your website to come up in the search engines. Everything that you do on a web page has to be catered to the patient's needs. So it has to be your social proof there. It has to be maybe before and afters. Be careful with before and afters, because believe it or not, as we think that, oh, I'm showing off my beautiful work, and obviously everyone can see that, patients don't always think the same. Seeing teeth closely sometimes doesn't have the same effect what we see clinically, because they just see that, oh, that's kind of like gross seeing teeth closely. Even our team members, we have team members who've been working on our team for 6-10 years, and sometimes they tell me that, oh, I'm gonna do this last because the before and afters, because it's just so disgusting. I don't even wanna see that. And these people are used to seeing teeth. So be very careful, for example, how you present your cases, because it can turn people away. To be honest, this is a huge topic, search engine optimization. So we won't have time to go into everything. There is really like science to everything, in a sense that you can support every single one of these items with numbers, and they will definitely affect your conversion. They will affect how long people stay on the page and how people are gonna respond, for example, to an ad that you put in Google. So if you have any questions about it, we are very happy to share the info in an email or with a phone call. So the conversion phase, we are still hoping that this person either clicks and makes an appointment or will call. If they click on a website, for example, and it's not mobile responsive, it's actually called responsive, but it seems that generally everyone understands mobile responsive better. So which means that it's not going to change the way that web page looks on any device. So if I pulled up a website on an iPad and turned it to the side, it has to respond to the screen. The same thing that all the different phones that are out there, it has to respond to that particular screen. If it's not easy to see the page there, patient's gonna leave, or prospective patient's gonna leave. They're never gonna become patients. If they click on, for example, a form to make an appointment, they can't see it on their phone, they're gonna leave. Again, the numbers are interesting. There's 15 to 65% online. Again, whose research you're looking at. It is more and more people are doing, making their appointment on their phone. They're doing business on their phone. So everything has to work on the phone. So once you have a website, make sure that check your website on, not just on your phone, on everybody's phone that you know, different phones and iPads, because you don't know what your prospective patient's gonna use. Make sure that it is integrated in your site properly. We see so many broken links, and obviously if you're running, for example, Google Ads, and the link doesn't work, then again, you wasted your money because patients can't make the appointment. We just recently had a huge practice who's been putting lots of money into Google Ads. They changed actually who they use for appointment forms. And something was set up kind of iffy. It worked, but not that well. The form was too long, and suddenly the conversions dropped, like significantly. And it was because it was just a way too long form, and patients or prospective patients went on that page, and people get distracted. The baby starts crying, somebody's at the door, and here your conversion goes. It's very expensive to lose someone who's already clicked from a Google ad and they came to their website, and then you're just losing them because your app doesn't work. The other point is the team point, the touch point. When someone actually calls the office, make sure that the phone is being picked up. I heard one of the presenters saying the other day that sometimes they are not picked up. Unfortunately, it is actually happening much more often than you think. When we have sometimes the clients complain that we are not getting phone calls. And then when we look at, from our end, the conversions, we can see that the phone is ringing, but they are not picking it up. So unfortunately, if you don't know what your team is doing, even if you think that the team is doing a good job, you might be thinking they're doing a good job, but they're not. Maybe they're not picking up the phone, or they're not picking up the phone the right way. But we also see that in many cases, if the team is not ready to handle the calls from Google Ads, they actually get upset that they get calls sometimes from vendors, because Google Ads are out there, so anyone can click on that number, or anyone can call that number just directly from their phone, from the app. And maybe it was a vendor. Maybe it was a patient who just wanted to reschedule. So the team gets actually very upset with those calls, and they're going to report it to you that Google Ads don't work. That's because your team wasn't ready to handle those calls. So now what we started doing, that we actually require everyone who's onboarded to Google Ads to do a script training, and not only a script training, but a training for the team to understand how Google Ads work and the type of calls that they are going to be getting. So the visit phase, first impression judging. When somebody walks into your team, to your office, and the team greets them, that's going to be the number one judging point. If a team member is not there and nobody's there to greet them, they're sitting there alone in the office, that can turn a patient off, and they might feel that they're not taken care of. Nobody was waiting for them on a scheduled procedure. So we have different solutions, and then if you look, there's so many technology-enabled solutions today. And then, for example, using your TV screens in the waiting room to greet the patients. One of the solutions we developed was because our clients were asking for it, is a TV solution to loop just simple greeting messages when somebody walks into the waiting room. So it's very simple, but I hear that all the time, that doctors are saying, well, I don't want to have that on my TV, so we still have daytime television. Well, those patients go into your office for a reason. They already dedicated the time for that procedure, so don't feel bad. And it's not something very off that if I go into a dental practice, there's dental stuff going on the TV. So yes, use the time, that's your time, and then put on the screen what you want them to see. So for example, introduce your team. If you have a centralized or a decentralized approach, you can still find a solution. So for example, with our solutions, you could put just one welcome message to all of your practices. But if you wanted to change it at the practice level and then show the doctors, introduce the doctors, or even put QR code enabled pictures, you can change your information here. You can pay your bills here. Follow us on social media. It's very easy to do that. It's a real-time change with our software, but there's so many other softwares out there for you to choose from. It's much better to have something in the waiting room than daytime television. So this is actually a sample that we have, and it's really just messages for the patient that you pick, and you can actually add that to a looping presentation, whatever you would like to communicate. The way we made our looping solution, and again, this was purely developed because our clients were asking for it, was that we made it fun for the team members. We see that the team members, every time when you tell them to use something new technology, they're gonna feel that, okay, here I am again with a new task. Doctor wants me to do this, and they're not happy to do that. But if it is a fun project, it's an easy-to-use interface, then you will see that they're actually excited about doing that, adding new loops, adding new messages, which will, again, impact your patient experience. So here are we at the treatment phase. Two different options. One would be when a patient says yes or no on the same day. The second one is when they decide on a different day. So if your patient understands the treatment that they selected, they understand the outcomes, they understand, they have reasonable expectations, they're going to be generally happier with the outcomes. If you use a treatment presentation system, if you use something chairside to explain your patients what that procedure is going to do for them, it will again have a huge impact on your patient experience, because those patients are going to be generally happier just because they know what to expect. You can use chairside, very simple messages. You can usually, with our solutions, put together a loop for any op rooms within minutes. So if you choose from anything that we already have, then it takes about 2 minutes to throw together one loop. We have clients who report that when they have a big case, they put it together for that particular patient just because it's so easy to do it. So if you know that somebody comes in for an all-on-4 procedure, you can actually put in a welcome message, welcome to your life-changing procedure. And here's what's going to happen today. You can also put up post-op instructions. So if a patient leaves your office, you can hand the patient like a printed document, or you can just ask them to scan something from the screen. If you do that, you will see that, number one, instead of giving out brochures, you will save on print production. And also you will hear it from the patients that they actually don't really use anything that they take because they misplace it. If they have a QR code and they already scanned it in their office, it will be still on their phone. They will be able to find it. So what happens is, in these cases, that when someone can pull information up, they are not calling your team. They are not coming to your office. You can possibly scan those codes, actually. They are not coming back to your office with an emergency because they don't know what to do. So you're saving team time. You're saving not only team time and even provider time, but you're guaranteeing for that patient that you're always there for them, because the internet and your website is always there. So they can go back to your patient post-op portal and then see what they have to do. I don't know if that QR code is possible to be scanned from your phones. It should be working, and it actually should be going to one of the clients' post-op portal. To make these post-op portals is very easy. So you can contact us, you can ask your website provider. The QR code solutions are available today so easily. It's very, very cost efficient to do that. Well, this phase is obviously the post-treatment phase is again the phase when you're gonna ask the patient for reviews, when you're gonna ask them for referrals. So obviously you want to release them from your office in a way that they're happy with the entire patient experience. Again, if you give them enough information, you enable them to reach your website easily to get the information that they need to ease, for example, just anxiety about the procedure. Sometimes it's a very simple question and they experience something that's normal. So if they go to your website, they can see a video, they can see an instruction on the website. Again, they won't make that phone call and they feel better. So these are actually just different samples that you can ask the patient when at the last touch point. I guess if you have any questions, we would love to answer that. Again, it's a huge topic, how to optimize your entire patient journey, but we have really good research as well on how it affects your KPIs. So conversion rates, obviously, and cost of conversion, those are all different, very important KPIs, for example, that's just related to the website. There's lots of research out there. If you would like to know, please contact us. And even if you just want to go back to your current marketing company or website company to talk to them, we would be happy to help you with the questions that you should be asking. So thank you so much. I don't know if there's any questions.
Thanks, Andrea.